Hi, welcome to the Abarca All-In video series. My name is Adriana Ramirez and I'm the Chief Operating Officer of Abarca Health. I'm here today with Francina Bonnelly. Francina, welcome. Francina is a clinical pharmacist for Abarca and she's our Director of Clinical Products and Services. We'd love to hear a little bit of what you do on a day-to-day basis at Abarca.
Sure. Within my area, I have a team of pharmacists, clinicians that execute on clinical programs day to day. So they're on the phone with members, with payers. And I also have within my area a team of product owners that work on the technology that we use every day to execute on these services.
Can you speak to us a little bit of what are the challenges that are being faced in the industry in regards to medication adherence?
So medication adherence or the lack thereof is one of the biggest problems that we have today in healthcare. Typical older members, older patients with chronic conditions have multiple medications that they use to treat their conditions. And a big gap in their healthcare is a lack of education, not knowing when to take their medication therapy. And this leads to hospitalizations. This leads to a decrease or a reduction in health outcomes. So it's a very costly problem as well because these members end up in the hospital. And for our payers, for our physicians, and for our clinicians at the pharmacies, it's an all-around problem that we have today.
What's the role, how would you describe the role of pharmacist in regards to medication adherence?
Being a pharmacist and having experience being in retail and in community pharmacies, a lot of the times the pharmacist is the healthcare provider that members see the most. And they actually build a relationship of trust with the healthcare provider. With their physicians, sometimes it's hard to get an appointment. It's difficult, right, to get access to your healthcare physician. And also, there's typically many physicians that you see, especially when you have multiple chronic conditions and specialty conditions. So the pharmacist being such easy access for our members and our patients typically is a really easy way for the member to get information on their medication therapy, to provide education on how to take those medications or close any gaps in their medication therapy.
As the leader of the clinical products team, we've developed several products through the years to promote medication adherence and other things within the clinical domain. Can you share a little bit about one of those programs that's dear to your heart?
We have our RxTarget program that basically it's an incentive program for our pharmacies that provides financial rewards when pharmacies reach certain cut points for adherence for their patients. And they do this through accessing our technology. It's our RxTarget platform that provides a customized dashboard. We built it in-house a few years back, and it ranks the members based on their status for adherence. And those members that are at the top typically are those that are at a higher risk for being in non-compliance with their therapy. It's a customizable tool and they can access it directly from the pharmacies. And in addition to improving health outcomes and reducing this problem of medication adherence, it also provides a way for our payers to improve their STARS ratings. So we've seen improvement in STARS ratings, and I'll talk a little bit about that. But also for commercial plans, we've seen improvement because medication adherence is not unique to older members. It's also important for the younger population that needs to make sure they take their medication on time and as directed by their physician.
Who's using this tool today?
We have our current network of pharmacies using the application, but it's not just the pharmacists. It's available to pharmacy technicians. And also within Abarca, we have pharmacies and case managers using the tool to identify those opportunities for adherence and doing interventions. And one of the cool things about the tool is that multiple users can be in the tool at the same time, and it'll highlight when someone else is doing an intervention for a member so that we don't double dip. There's a lot of members within our population, a lot of patients we want to talk to. And, sometimes we need multiple folks, working together to reach our target, which is the overall goal of improving health outcomes for our members.
What are the results, if you could share some of the results that we've seen in that Medicare population?
We've seen really good improvements in the past couple years. Last year, we saw an overall improvement of 6 points for adherence for a big Medicare payer here on the island. And the year before, we actually saw a 10% increase in our adherence measures. And we continue to see improvements. We're very bullish about our results this year.
What is, in your view, the highlight of this product?
A couple things. I think that it provides a holistic view of the member, of all their conditions. And you can track and see their trends. The tool provides a lot of really cool functionality and images that, there's certain use cases where we see members that split their pills. So we see that they come to the pharmacy every other month. And we can track that through the application for any one of their chronic conditions. And additionally, I think that it provides a way for anybody within the healthcare team to provide these types of interventions and have this type of visibility. What we see today, if a member goes to one pharmacy, that pharmacy can see the claims processed for that member there. But we know that it's very common for a member to visit multiple pharmacies and multiple physicians. And what this application does is that it provides one view, one location for the medication therapy for that member to be able to target where those problems are, address them, and document them. Because the data that we get from this application can tell us a story. So are we seeing a problem in a town or a certain region of the state or the island, and be able to address them? There might be a social determinant of health where members can't go to the pharmacy or can't go to their physician, and the tool is just rich of information for us to use when we target these types of problems for our members.
Speak to us about how those results are showing up.
In addition, as you said, for our Medicare payers and sponsors, the adherence is a measure within stars. So they get financial incentives for having a higher star rating. And in addition, we've seen that in the program, we've provided large sums of financial bonuses to pharmacies that are performing well as part of this program. So it's an ability for the pharmacy to collaborate differently as part of the team for the member, and also receive a financial incentive for their efforts. Sometimes it gets very crazy in the pharmacy with phone calls and lines and Q&A with the patients. So this program provides a way for them to get a little extra cash on the side.
They're really front and center with the patient. Like, why not leverage them and give them this tool?
Totally, absolutely.
Really appreciate you joining us today. Thank you very much. Thank you everybody for joining the Abarca All-In video series. Looking forward to connecting with you guys on a later session.
Thank you.